Everybody thought she's crazy. A 64-year-old woman had been living with hypertension for quite some time. She began experiencing some unusual sounds in her left ear. And these weren't just any sounds, it was like nightmares. She could hear strange and unsettling noises, and she knew something was terribly off. The discomfort and anxiety led her to seek immediate medical attention. At first, even medical doctors were puzzled by the patient's symptoms. Rightfully, doctors thought this strange noises could be related to a psychiatric problem, because in psychiatric cases, it's not very uncommon to see these kind of patients. After all, what else could it be? But soon they realized this is a medical challenge. It wasn't a psychiatric problem, it wasn't a simple medical case, it was a challenge. Here's what they did. They conducted another round of examinations, but this time even more detailed. And the unexpected happened. They found a tiny intruder. 8-legged intruder. Yes, spider. Even more interesting, the exoskeleton of the spider was also present. So our tiny spider had made itself quite comfortable. So the medical team carefully removed the spider from patient's ear, and everything went well. As we wrap up this unbelievable story, let me tell you this. In medicine, everything is possible. Everything. So that's it for today. Thank you so much for being here. If you liked it, please give us a thumbs up. And of course, please hit that subscribe button. Until next time, goodbye.